stroke. The parts of our country that have the highest numbers of strokes happening or survivors living there, it is South Australia and Tasmania that top the list. But there is no postcode untouched. We see large numbers of people in regional New South Wales along the coast, from the stretch down from Ballina to Sydney, with high numbers of stroke in those federal electorates. Regional Victoria is another part of the country where we see large numbers of people living after stroke, or more strokes than happen in other parts of the country. And we've also seen in this report that there are parts of Queensland where there are higher numbers of people with stroke risk factors than in other parts of the country.
What's the balance here between treatment and prevention? When I say treatment, I mean when you've got a stroke, it's known that if you hit a centre which has an acute stroke unit, where you're going to get thrombolyzed with a clot, if you're eligible for it, the clot gets busted and you get acute rehabilitation, you do far better and are much more likely to walk out with lower rates of disability than if you go to a hospital that doesn't have a proper stroke unit. To what extent is the treatment of acute stroke versus prevention that's causing this burden of people with disability with stroke?
I would say, Norman, that it's both. We have never had a fully integrated and funded preventative health program for identifying and managing stroke risk in Australia. So ensuring that people, once they get to the age of 45, are able to talk to their general practitioner about their stroke risk is an important step, but it's not going to solve the problem in its entirety. We will still see strokes happening.
And our standard of care in hospitals for the treatment of acute stroke, that's been hugely controversial in the last few years.
It has, and it's still not at a level where we are seeing optimal outcomes for people who've had a stroke. You mentioned stroke unit care, incredibly important. It's a fundamental basic component of stroke care and considered a given in many parts of the world. And yet in this country, only 6 in 10 Australians who have a stroke get onto a stroke unit, and in some states it's as low as 3 in 10. So there is a real need to be looking at getting better access to stroke unit beds in Australia, and over the last decade we've seen real shift, positive shift in the number of stroke units being established. But we also know from our most recent analyses that many stroke beds are not available for stroke patients, which means they're missing out on coordinated care that, as you've identified, will give them a much better chance of survival and good recovery.
So centrality of the general practitioner in this, and presumably taking political note and minimising the barriers to seeing a GP for preventive care.
That's right, making sure people can get in to see their GP, and that GPs are supported to be able to do an integrated check that considers diabetes, kidney and heart disease and stroke risk is really important. Getting better access to stroke units in hospital. And for the 440,000 people who've had a stroke who describe life after